First set of points we're going to do are sima. Sima are 4 horses. 4 horses are a group of 3 points used bilaterally. And they're going to be used bilaterally because this is an internal diseases. So internally, we consider points to be used bilaterally. Now if we're doing external medicine, then we're using primarily the opposite side with a guide on the same side. So the 3 points are Sima Zhong, Sima Shang, and Sima Sha. So we start by finding the middle point, Sima Zhong. Zhong is the middle 4 horses. So what we do is we're looking to find Feng Shi. Feng Shi is gallbladder 31. So typically from the textbooks we think 7 sun. 7 sun from the center of the kneecap. So there's a little debate around that. I usually go about 7 to 8 sun above the patella. So lots of different ways to find that, as you know. So once you've found that distance, then we want to find the outer line of the patella, of the kneecap. Same here. So what we're doing is we're drawing that line back towards the patient. Like so. And these points are always perpendicular, and they're heading towards the bone, towards the femur. Typically, this point is 1 sun to 2.5 sun deep. Typically used for hypochondriac pain, which in this case, since we're focusing on internal medicine, we're not looking at that so much, but also breast pain. And for those first 2, we'd probably use them on the opposite side. For this internal medicine class, we're going to be using bilateral. So we're thinking more of internal medicine issues, hypofunction of the lung. Incredible point for lungs, all kinds of hypofunction for the lung. Asthma and hypothyroid. Two conditions that these points are really wonderful for. Also used for skin conditions, but needled differently. But we're not going to go into that one today, but it's a good one to remember. I use that for that often. Also recommended for hemiplegia. Again, opposite sides, but for this one I actually prefer Si San Li and Si Sha San Li for hemiplegia. So once we've found our Feng Shi, and then we've found the lateral edge of the patella, and drawn that up towards the patient and needled that point, then we're looking to find the upper of that. So it's 3 fingers or 2 sun. Again, strong area, lots of qi and blood through the stomach channel. Now this is actually not on the stomach channel, but just outside of it, between the stomach and the gallbladder channel. And all straight in a row, all in the same direction. And oftentimes we're going to be tapping the bone. So there we have it. Sima Zhong, the first one. Sima Shang, the top one, 2 sun, 3 fingers above, and 2 sun below Sima Zhong is Sima Sha. Again, needled 1 to 2.5 sun deep, and the conditions that we're considering here primarily are hypofunctions of the lung, as in asthma, TB, you name that, all the above there, and hypothyroid. The neurological relevance of this particular area is always interesting. I like to sometimes look at the neurological, the vascular, or the muscular interventions that are here. And this one, the one that makes the most sense to me, is common pulmonary nerve and the hepatic branch nerve. So nice things to think about since we're between gallbladder, so Xiaoyang, and Yangming, stomach channel. So lots of qi, lots of blood in this area, so very strong points at the thighs. So once these guys are in, strong stimulate. And from there, we'll go to the other side. Again, so finding our Feng Shi point, the outer aspect, the lateral aspect of the patella, draw that towards the patient, proximal, needle perpendicular to the surface, and it's towards the femur. Sun above. To swim below. And not uncommon, very common, to tap the bone, to tap the femur. So there we have Sima, 4 horses. Very useful for many different conditions. By all means, I've only named just a few of them here. Primarily, we're considering lung function and hypothyroid. Actually, also good for hyperthyroid as well. But we might add some other points with that as well that we will probably be reviewing here in the near future. Often I use these for allergy, asthma, hypothyroid, as we've already mentioned, of course, and for skin conditions. But then the needles are, after 10 minutes, pulled out so that they're only a ½ inch retaining. And then these points also should be left in for 45 minutes to an hour plus for a good long treatment.